afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years, and incident is higher in older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can worsen its symptoms. Consult a nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria, its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Aslam K. Ahmed. He's MBBS, MD, Chief Consultant Dermatologist, aesthetic dermatologist. He is also the director and chief consultant at Sage Skin and Hair Kochi. He has years of experience in the field and has skill and compassion, and his skill and compassion has made a tremendous difference in the patient life. A warm welcome to you, doctor. It's a pleasure to
Thank
host you
you.
today, and
Thank
we
you.
are going to talk on a very important topic, which is the management of urticaria. First of all,
Yeah.
I would like to ask you, what is urticaria?
Yeah. Hi. Good afternoon, everyone. So basically, urticaria, we call it hives. So basically, these are very common, it presents as reddish, kind of well-defined swelling, which always itches, It'll go about in like 1 hour or 2 hours and usually goes away in like less than 24 hours. So that is what urticaria lesions are, basically.
Right. So, speaking about the lesion, the skin being the largest organ of our body, we see a lot of changes happening in our skin every now and then. And we tend to confuse urticaria with any other condition, maybe some itching due to some insect touching the
Correct.
skin or whatsoever. So, how do we identify this is urticaria and this is the right time to visit the doctor? How does the initial stage look like?
See, that's what like, urticaria we can classify it as acute and chronic. Okay, so basically, in all cases, the thing is it usually goes away in like couple of hours or something like that. It usually don't, it won't be present more than 24 hours, or at least it'll go in 48 hours. So basically, these are very transient swellings. It'll be pinkish red in color, and it has a lot of itching, unlike other skin conditions which tend to last longer. So if it
Hmm.
goes away quickly, that is when you know that it's basically urticaria that you're having. So there are a lot of other skin conditions which can seem to be urticaria, but it's not urticaria. Even like as you mentioned, like insect bite reactions, papular urticaria. Those are all things which can be which can look like urticaria, but it is not usually urticaria, and it'll stay for a longer time. It usually doesn't go away like when you take a tablet, or it usually goes away like on its own, like in a couple of hours, even 30 minutes. It's like that. So if it goes away quickly, then that is when you can suspect that it is urticaria.
Right, right. I think this question everybody would have in their mind. People who are watching us right now. So, why do they visit the doctor if the condition, if the marks go away, if the lesion goes away? Then why to visit the doctor? It's all we
Good
are fine
condition. It
already.
goes away temporarily. That is the thing. It goes away, then it comes back like that. So basically, we have categorized it as two, like acute urticaria and chronic urticaria. Acute is usually like
Mm,
like when you get something, when you eat something, like there will be a trigger for everything. So anything under the sun, including the sun, can cause urticaria. So like whatever the trigger may be, you will get these urticarial lesions and it goes away, but it comes back like that. So you'll be like it's kind of distressing because you get a lot of itching at that time, and it's very distressing to have urticaria. But if it is chronic urticaria, it will last for more than 6 weeks. Acute urticaria lasts less than 6 weeks, but chronic urticaria lasts more than 6 weeks, which is very distressing to the patient. And the itching is very severe, and so they usually, like, without medications, it won't go away. But self-limiting, as I like, what I meant was the lesion, once it appears, it will go on its own, but it will come back. That is what it is. Yeah.
Right. Right. Now, doctor, let's talk about urticaria, which is caused from food. Uh,
Yeah.
can this happen that the person has always had that food throughout his life, and
Correct.
all of a sudden, someday he sees some changes in his skin because of having that
Yes.
particular food? Can this
Yes.
happen?
Yes, very much, very much. Because everyone has it. Because mostly the thing which you're commonly allergic to is eggs, peanuts,
Mm,
chocolates, and all those things are the seafood. Yeah, like the most common allergen that you can see. So, like, you must have heard people saying, like, till 40 years I didn't have anything, but after that, when I ate seafood, something like prawns or something like that, I'm getting allergy. So, basically, it's your immune response. It's not like as a disease as such. It's basically your immune response. It's your immunity that is kind of overreacting to the external stimulus. So any age you can have like urticaria. Like, you may not be having the same allergy like before, but you may develop new allergies and all those things. And newer studies have shown that usually it is said that you have to for the babies, you have to put babies on exclusive breastfeeding till 6 months and introduce food like very little by little after one. Like, some people, in my place in Kerala, the custom is like, after 1 year or 2 years only, they'll give the baby like egg and all those things. So basically, like,
mm,
however late we start, there are more chances of developing allergies. So evenly, recent studies have shown that like in 4 months, like till 4 months, you can give exclusive breastfeeding. Then you can expose the kid, like baby, to all the food that you eat. So early introduction of all the foods, tend to reduce the chances of allergies in during adult life.
So, doctor, let's talk about the thing which you have just mentioned. We have never seen parents or family members feeding child apart from breastfeeding milk or before 1 year maybe. So, why
Yeah.
is this change all of a sudden? How come we are getting to see this right now?
See, the thing is, when parents are allergic to things, parents have the problem of allergies. Like, allergy is a very broad term, as you see, like, because it's basically the immune response. There are a lot of diseases which comes under that umbrella of the allergy, that, as we call it. So,
Mm,
when your parents are allergic, then the kid is also, they tend to develop allergies later on. So, in those kids, the safest thing to do is introduce all the foods as early as possible, so the body adapts accordingly. And the thing is, whenever I tell to all my patients, if when you're introducing a new food to the baby, always give it in the morning hours. Don't try to give it at night, because like, there are chances of developing allergies to anything. So that's what I said. Like, there is see, even though we say that the most common allergens are eggs, peanuts, and chocolates, all those seafoods, all those things, you can be allergic to anything. There are people who are allergic to sesame seeds. There are people who are allergic to cold water, and all those things are there. So anything under the sun, as I said, including the sunlight, can be a cause of allergy. So basically, the thing is, when you introduce a new food or anything, I always tell them to give it in morning hours, so that if the baby develops any allergy, also you can get any help or things like that. So it's very important that you introduce all the food earlier in life. Yes.
right, right. Well, that is something new that we came to know today. We are talking about urticaria, and we are in discussion with Dr. Aslam. Doctor, moving ahead, you have just mentioned genetics. So,
Yeah.
as we are talking about urticaria today, there can be a genetic predisposure as well in this case.
See, it can be there. Mainly, all this, in urticaria, it's more common in females, like twice as common in females.
Mm,
The one important thing about that is that, females tend to get more of autoimmune diseases and connective tissue disorders as such. So, urticaria can be associated with all those things. So, I'm not saying it's purely genetic. It's basically like, basically what it is caused by, it can be associated with other diseases also. And which it is very specific, I mean, very common in females than males. In that aspect. So when it is connected to autoimmune disorders and all those things.
So, what can be the prevention strategies in case anybody wants to know that?
About what? To prevent urticaria.
Yes.
See, the thing is, when you know that you're allergic to something, the most important preventive measure that you can do is avoid that thing. See, if
Yes.
you know that you're allergic to peanuts, the most important thing, the most important treatment step that you can take, is not visiting the doctor, is to avoid the thing that you know that you're allergic to.
Mm,
So that is the most
mm,
preventive measure that you can take. But then, like as you said, like if you see a doctor, then he'll be giving all the blood tests and all those things. Those are for like finding out if there is any association, any other associated diseases. He might be checking thyroid and other autoimmune diseases depending on your symptoms and all those things. But in case of acute urticaria, the diagnosis is very easy. Like urticaria which is lasting less than 6 weeks is what we call acute urticaria. Usually it is mainly for food, or it's basically some infections, any bacterial, viral, any other infections or infestations like worm infestations, anything of that sort can cause urticaria. So acute urticaria is not big of a problem. It can be like treated very with simple antihistamines, with the simple tablets. So when it lasts for more than 6 weeks is when we tend to do a lot of blood tests and find out what is the actual reason for the urticaria is. So usually, like when you go to a doctor, you'll get an idea like how to go about it.
right, right. Again, Dr. Sun, as you said, everything under the
Yeah.
sun, and in fact, the sun itself can be a reason of urticaria.
Yeah.
These are like very serious things. Urticaria from water, maybe rainwater can also cause urticaria. Sun can also cause
Yes.
urticaria. So, uh, we anyway have to go out in the sun. So, how
Yes.
do those people who are facing urticaria from the sun, how do they prevent themselves?
See, you have to use protective. You can use protective clothing. You can use sunscreens. Preventive measures like that. It's not only sun. Okay, like we call it physical urticaria. All these things we call it physical urticaria. So basically,
Mm,
it may be cold induced, it may be heat induced, it may be solar induced, it may be like exercise induced. Some people, like work out a lot, they sweat a lot and they get urticaria. Some
mm,
people, when they come in contact with cold water or even vibratory things. So vibration can also cause urticaria. So all these things, like when you go out in the sun, you get a lot of flare ups, a lot of wheels and things like that. You have to use protective clothing. You have to prevent, you have to take preventive measures like that.
right. And doctor, what about self-medication? We see a lot of people normally when they see any change in their body, they either suggest take advice from their family members or they visit the chemist. So how
Yeah.
harmful can a self-medication be in this scenario?
See, as I said, like there is no, it's not always one plus one is two in medicine. So basically, if you have a problem, you have to find out the root cause. Okay, so if you
Mm,
have urticaria, it may not be like urticaria as such. It may be maybe a systemic manifestation of something else. So basically, like seeing a doctor is the best thing, the simplest thing that you can do to yourself. So basically, the thing is, when you go to a chemist, you will be prescribed an antihistamine. Okay, so sometimes what happens is you may be unnecessarily taking lot of antihistamines and lot of steroids. Some people may like in India, it's very common that you get steroids over the counter, and all those things are there. So usually, and we see a lot of people applying steroid creams for urticaria. So those are not the actual measures that you do. Okay, so basically, over-the-counter medications is not really, not really in your not really a good idea. Yeah.
yeah. So can this also be seen that over-the-counter medications can also cause urticaria?
Yeah, there are a lot of painkillers. You go to a chemist and you say you have like fever, you have pain, might prescribe you aspirin or any other non-steroidal anti-inflammatory drugs. So all these things can cause urticaria or angioedema, all those things. So some drugs are there, which can cause like urticaria, and some other drugs like angiotensin converting enzyme. Like there are a lot of some kind of drugs which can induce urticaria as well. Yes.
Right. What about stress, doctor? Stress can also be the reason of a lot of diseases. Can it also be the reason for urticaria?
As I said, that exercise part I told you about, no? So basically, that is kind of a stress. So not only physical stress, even emotional stress can also cause urticaria. So it all comes under the chronic urticaria. So basically, if you have like emotional, physical stress, if you have a lot of sweating, if you have a lot of, if you take hot showers, cold showers, if you take like do a lot of exercise, all these are kind of stress to the body. So all these can cause urticaria. Yes. So finding
And
the
what about
root
the
cause is
treatment
very important.
options?
That's why.
Yes.
So finding
Right.
out the
Right.
root cause
Right.
is very important. That's why you go to a doctor and he will ask you 100 questions. So that is not to annoy you. That is to find out what the actual reason behind it is. So basically, that is pretty important when you have urticaria.
Right, right. We always say that when we're talking about urticaria, knowing your body, knowing yourself is very much important. You
Very
should monitor
important.
everything which is going wrong in your body or any changes which is going on in your
See,
body.
it can
We
be a
cannot
simple
neglect that.
tooth infection, it can be a simple tooth infection which is causing all these symptoms, but you will not know it unless you go to a doctor. It can be a
Right.
frequent urinary tract infection in females which is causing the urticaria. It can be anything. It can be a worm infestation. So likewise, like you cannot like pinpoint, you cannot just diagnose it like
Mm,
that. So a very
mm,
important history and physical examination is very important in urticaria. When it lasts for more than 6 weeks, yes, we have to do some blood tests to rule out any thyroid diseases, any other autoimmune diseases, any other infections, and like that. So basically, you cannot treat it yourself. That is what you have to understand. So it's not always a peanut allergy or a sunlight allergy which is manifesting as urticaria. So it can be anything. Yeah, basically.
right, right. Doctor, what are the treatment options currently available for treating urticaria?
As I said, in case of acute urticaria, usually the main thing is to avoid the triggering substance. Okay, so if you know, like what I tell my patients is like you have to write down whenever you get a urticaria, you have to write down what all things you did like just before that, the food you ate, like any new things that you did, so like when you write it 3 4 times, you will get a common thing which is causing all the problems. So avoid that. So that is one thing that you can do, that you have to do it even before coming to a doctor. So then that is the one treatment. Then the other treatment options are like, if it's very acute urticaria, you can treat it with antihistamines. What we usually do is give two antihistamines at one time. Then you wait for like one week or 2 weeks, and then if it doesn't come down, we updose it. You can increase the dosage up to four folds. Then you can, like, what I'm talking about is a second generation antihistamines like cetirizine, loratadine, fexofenadine, and all those things. So even after updosing all the antihistamines, and if you are getting urticaria lesions, what you can do is you can add things like leukotriene antagonists, receptor antagonists like montelukast. Then you can add cyclosporine. You can add omalizumab, and newer things are there biological like omalizumab and all those things which are Ig anti-IgE medications. So it goes in a ladder as such. So there's nothing like you can't be like you have to do a trial and error with medications. Some people respond to very low doses of antihistamine. Some people do not respond to even like high dose of steroids. So it's basically depends on the kind of urticaria that you have.
Doctor, what can be the potential complications related to urticaria if left untreated?
Sorry, I didn't get you. Sorry.
What are the potential complications of urticaria if left untreated?
See, if it is left untreated, the thing is, we won't know if it is a like if it is a part of any other underlying condition. Okay, so basically, you may get urticaria now, but next day the allergy response might be different. Okay, next time you may get like a lot of angioedema. So angioedema is basically like similar to urticaria, but which happens in the oral, lips, tongue, like in the genitals, in the neck and throat and all. So if you get a lot of big time like an anaphylactic kind of reaction, that it might be life threatening. So first time you may get a lot like only wheals, but next time you may have a like exaggerated response which will lead to anaphylaxis and sudden allergic reaction. So you have to treat it anyways. And other things is like if it is part of any other systemic diseases, if urticaria comes as part of any other systemic conditions, we would know. So basically, like treating the thing is very important.
Right. And Is it also contagious?
No, no, never,
Any
never.
hygiene which one should maintain if he or she or anybody from the family is suffering from urticaria?
No, not as such. Like, there's no actual, direct relation between hygiene and urticaria because, see, the thing is, if you're, if you're not like properly the hygiene, I don't know, like, it doesn't come as such as a big deal in kind of urticaria. So, not as such. It's not contagious as such. Not like that. It's basically like
So,
what our immune response. Basically, it's an exaggerated immune response. So it's not contagious. It's an individual
right.
thing. Yeah.
Right. Doctor, we are speaking about immunity again and again here. So, how can one, make the immunity better if somebody is suffering from a poor immunity? What are the food? What are the
Eat
lifestyle
good
they need?
food. Eat good food. Things like that. Vitamin C, rich foods, and all those things are there. Probably like the immunity will always be better if your nutrition is better. Okay, so some people have like exaggerated immune response is what we are talking about in urticaria, not the lack of immunity. Okay, so in urticaria, the thing is the immunity is there. It's not because the immunity is not there. It's because the immune system is responding quite aggressively. So basically, there's no question of lack of immunity in case of urticaria.
Right. And can COVID also cause hives on the face?
See, any infection, any viral infection, any bacterial infection, any fever can cause urticaria. That's what. It's like some people get like throat pain, the throat infection is quite common. No, some people get tooth infections. All those things can cause. So, COVID is a viral infection. It can cause urticaria. Yes.
So for the people, women specifically who are suffering from urticaria, especially in the facial area, what kind of skincare do we suggest them? Normally, we are suggested to have a proper skincare regime by our dermatologist at today's time. So, what kind of skincare would be safe for them? Can they use all those market products which people are using nowadays, all the retinol and peptides and all those niacinamide and all those things? Will that be safe, or what do we suggest normally?
See, in the phase when you get a lot of flares, it might be because of your exposure to sun. It may not be
Mm.
urticaria as such. It may be like there's something called polymorphic light eruption, and all those things are there. So basically, what those things are like because your skin becomes more sensitive, you tend to get a lot of rashes over the face, and some autoimmune conditions also you get a lot of rashes over the face, over your cheek area. So all those things are there. So it doesn't necessarily have a direct correlation with your skincare, but it's better to use if you have very sensitive skin. It's better to use a cleanser. Like instead of a face wash, you can use a lightweight moisturizer. You can use a gel based or a very lightweight sunscreen. So those things you have to use. Okay, so that will actually prevent you from, having a like a sunburn or things like that. And to be on the safer side, what you can do is you can use a physical sunscreen rather than going for a chemical sunscreen. You can use a physical sunscreen as such. So, like many people don't find it very appealing, cosmetically appealing, but it's the safest thing to apply on the skin. Even it can be applied to babies. So, basically, a physical sunscreen you can use if your skin is very sensitive. You can use a mild cleanser and a moisturizer. Those things you have to use anyways. But when you get only over
Right.
the face, you have to roll out other things also.
Right, right. So, doctor, we have heard a lot of patients asking us, why do urticaria get worse at night? What would be the answer for that?
It might be because of the cold which is induced at night. Because some people they tend to like many of my patients they tell like when I switch on the AC, that's when I get urticaria. So it may be related to cold. In like very cold places at night, it can be because of that. So or anything that you use at night may be causing the thing. So basically, all those things are there. Yeah.
Right. So, doctor, we normally see any condition, any disease can also lead to a dysfunctionality of another organ or another part of our body. So, can urticaria also trigger any other organs, any other part of our body?
Not as such. I mean, simple urticaria will not cause any other like major complications as such. But as I told you,
Mm.
like if it is part of any other diseases, Okay, so there's something called urticaria pigmentosa. Okay, so basically that is cutaneous mastocytosis. That is entirely a different thing, different disease. So it might mimic urticarial lesions. So if you don't treat it thinking that it is urticaria, it might affect other organs. So it might affect liver, spleen, kidneys, and your GI tract and all those things. So urticaria, as such, if it is a very simple acute urticaria, it won't lead to any other like major complications like that usually. Okay, but if it's a part of any other diseases, yes.
So, specifically, if we talk about diabetic patients, we see a lot of people suffering from diabetes at today's world. Even
Yes.
children are suffering from diabetes nowadays.
Yes.
Is the treatment different for them? Can it be difficult for them to be,
See,
to get
type 1
cured?
diabetes is something that that happens to kids, small kids and things like that. So
Right.
that can even cause urticaria. So that can be a precipitating factor itself. Okay, and if the patient is diabetic, you tend to get a lot of infections, and maybe it may be associated with other things also. So treatment differs, yes, but if it's a very simple urticaria, you can control it. Even in those patients, you can control it with simple antihistamines, but you might have to take it for a longer time. So that depends on the severity of the disease. Yes.
So,
And
so what
if
about?
if you have
Yes, please.
diabetes and things like that, you may not be able to use steroids, oral steroids, and things like that. So treatment will be different for them. Yeah,
Right. What about reoccurrency, doctor? Is there a chance of reoccurrency
of
once
course.
the
Yes.
patient has been treated and cured?
Yes, you cannot say like anything that comes under the umbrella of allergy, that broad term, which you cannot promise anything under like autoimmunity and allergy. You cannot, completely promise that it won't come back. So usually doesn't come back if you avoid the precipitating factor, avoid the trigger, just avoid the trigger and, take your tablets regularly. You cut down the tablets when it's time. Like when your doctor says to, cut down the tablets, you do that. And then you can eventually stop the medications and then you avoid the triggers. Usually you won't get it, but we cannot promise that you won't get it again. Yes.
Doctor, speaking about specifically oral contraceptive pills, can that also cause urticaria? We see a lot of women, a lot of girls nowadays, they go for oral contraceptive pills without taking any suggestion or any advice from the doctor. Can that be helpful or harmful? Sorry.
See, the main drugs that cause urticaria is mainly that what I have mentioned, like aspirin, NSAIDs, and all those things, AC inhibitors, and all those things. But you can be allergic to anything. Okay, so see, there are people who are allergic to paracetamol, which is the most common abused drug in the world. Okay, so basically,
Mm,
you like a lot of people who are allergic to paracetamol, and any drug or anything can cause. Like, it is not specific. Like, it doesn't fall in the category of the most common drugs which cause urticaria or angioedema, but yes, it can cause.
right. And if you speak about your experience, doctor, what was the worst case of urticaria you have seen so far?
See, the thing is, urticaria, as always, there are people, who have treated it as. I had a patient who got misdiagnosed. So basically, she was
Mm,
treated as sunlight allergy. Okay, so
mm,
basically, she had a lot of hives, and she was not able to work at all. So she carried it for 6 months. And then she was given some steroid creams and all those things. She was misdiagnosed by some, like, not from a dermatologist, and she was misdiagnosed as sunlight allergy. Okay, so she was given only steroid creams. She kept it for 6 months, and she got a lot of fungal infections because of the steroid abuse. She used to put steroid creams for 6 months. So that was a very strong steroid, and she kept on using it, and she got a lot of fungal infections, and her skin was totally destroyed, damaged. So after all, like when I took a history, it was just a case of urticaria that she was getting like urticarial lesions. So that is by far the saddest patient that I've come across recently.
so can those cases be also cured?
Of course, the thing is, the only thing with her was because of the long-term steroid abuse, she had a lot of, very bad thinning of skin, and she had a lot of problems related to that. So that was the only thing. So she will need, yeah, couple of months to recover from that. Lot of fungal infections because of the steroid abuse and all those things, but still can be treated with simple. Gave her a simple antihistamine for like 2 3 weeks and she got cured. So not cured, but she her symptoms came down. Yes.
Right, right, right. Doctor, urticaria can happen at any place in our body, maybe, as we already know by now. So, for the people who are suffering from chronic urticaria, do we suggest them physical exercise normally to maintain a healthy lifestyle? Food, sleep, and exercise is very much important. So, what about the patients who are suffering from chronic urticaria? Do we also advise them to have a normal physical workout every day?
Sure. There's no problem with that. See, if you are allergic to something which is not related to exercise or physical activity, why not? You can have
Mm-hmm.
a normal physical activity, you can have normal exercise and all those things. If it is causing any problems, then you may have to, you may have to start your medications like that. There are the exercise-induced urticaria is very common. There are a lot of people, who complain that, after post-workout, after sweating a lot, you get a lot of itchy rashes. So all those things are very common. So basically, if you don't have that, then there's no problem in doing the physical activity. You have to have a like proper physical activity and a proper healthy lifestyle. Yes.
Right. Moving ahead, Doctor, I can see a few questions coming up from the viewers. The first question comes from Yash Namdev, who asks, "What can I expect in terms of how long this will last?"
Usually it goes away like in few weeks. Okay, so if it's a very acute attack, like you ate something and you got hives, usually it goes away on its own. Okay, but if you're getting it again and again, you have to be on medication for few weeks. Then if it when it doesn't happen, we cut short the medication, the dosage. We give it for like maybe mostly a month or 6 weeks like that. It only depend always depends on if the trigger factor is removed completely, you may not get it again. So you can have a very speedy recovery. In some people, if it is associated with something else and if the trigger factor is not identified, it can go on for a long time like that.
Right. Doctor, the next question, it comes from Akansha Puri, who asks, "I'm pregnant and have urticaria. Is this, can this be contagious? And how can it hamper my baby?
No,
So,
usually
can this be
urticaria.
contagious? And can my baby have it as well?"
No, nothing like that. See, basically in pregnancy, the only problem is you can't have like more stronger tablets. That is the only thing. In first trimester is the only time where all the medications are a little tricky to use. Okay, so if she's in the first trimester, she can still have antihistamines. There are a lot of antihistamines which are in pregnancy category B, that is which is considered safe in pregnancy, but you cannot put her on higher doses, and you can't put her on other medications. That is the only problem. She has
Hmm.
urticaria in pregnancy, not an issue, can be controlled with medications.
Right, right. Nothing to worry then. The next
Nothing to
question
worry.
comes from Pooja Sharma, who asks, "What is the role of vitamin D in treating urticaria?"
Vitamin D as such will not cause anything. So, but the thing is, usually in everyone, at least in Kerala, I stopped, testing for vitamin D because everyone is having vitamin D deficiency.
Hmm.
So, as such, urticaria is not a symptom that, which we usually see along with vitamin D deficiency. But yeah, vitamin D deficiency is very common.
Right. The next question, doctor, comes from Deepak Saxena, who asks, "If my urticaria is triggered by something specific, can I avoid it?"
Yeah, you have to avoid it. That is the whole point of treatment. So basically, if you're allergic to peanuts, you'll have to avoid the that thing. So basically, that is the first treatment that we suggest. Yes, you have to avoid the trigger.
Right. The next question comes from Pooja Vishwakarma, who asks, "What is emergency treatment for urticaria needed? When is emergency treatment for urticaria needed?"
Yeah, emergency treatment is needed when you have, if you find someone who has urticaria like all over the body, and you can, who will complain of, struggle, like he's struggling to take breaths, he has like the sound changes, there'll be some hoarseness of voice. So all these are indications of anaphylaxis. Okay, he'll be having a high heart rate and things like that. He'll be panicking a lot. So that is the time where, you know that he's going into anaphylactic shock. Okay, so basically anaphylaxis is a very critical condition, like very condition which warrants emergency care. So in that cases, emergency treatment with adrenaline, everything is required. Some people carry the EpiPen that we call. EpiPen is basically something, if you know that you're allergic to something, then people used to carry that epinephrine shots. Basically, it's an adrenaline shots. So usually they carry that if people are very allergic. So if they expect any anaphylaxis, they carry that. So if you have a like anaphylactic shock like of thing, like there'll be like some hoarseness of voice, difficulty in breathing, all those things you have to take them to a hospital and give emergency treatment. Yes.
Right. And with that, doctor, we have the last question coming from Firoz Khan, who asks, how can I prevent future outbreaks?
So basically, the thing is, you cannot be completely sure that you won't get it again. Okay. Basically, I said it's the immune response which is the factor here. So the see, if you're only allergic to certain things, the best measure that you can take is to avoid all those things. Okay. So then, like depending on the trigger, like if you're exposed to sunlight, use protective clothing like that. If you're like allergic to some food, you have to avoid those things. So basically, avoiding the trigger factor is the only way that you can be like so sure that you can avoid further attacks. But don't worry if you get further attacks. That is the whole point of this discussion. So it's not a like it's not something that it's not a life threatening disease as such, like unless it goes into an anaphylactic shock. So don't worry about it. Don't worry about the future attacks. Avoid maximum, try to avoid the trigger factors. So that is the only thing that we can do. And if you further get urticarial attacks, we can put you on some tablets for a like few months or something.
Right. Well, we had a wonderful discussion on urticaria today, doctor. Before we take a leave, any take home message for our viewers who has watched us so far?
Nothing. See, basically, urticaria, the thing is get diagnosed properly. That is the only thing, that you can do, and avoid over-the-counter medications. Avoid using steroid creams. It's off topic, but we've been lately seeing a lot of steroid abuse, whitening creams, and all those things are there. So avoid all those, over-the-counter treatments. You consider yourself, I mean, your skin as the largest organ in the body. It is the defense that you have. It is the army that you have to fight against all the things. So basically, you protect your defense. So that is very important.
Well, that was expert advice for today, and that was Dr. Aslam for us. Thank you so much, doctor, for your valuable
Thank
time.
you.
It has been a very, very
Thank you.
informative session for our viewers today, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. In case they get to see such symptoms, they now know what to do. It's
Yeah.
always better to approach a nearby dermatologist than self-medication. It
Yes.
was great to hear from
Always.
you, and we look forward
Thank
to
you.
many more such sessions ahead. And thank you so
Likewise.
much, viewers,
Likewise.
for your
Thank you.
excellent participation. To get latest update on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.